Everyone knows that once a person suffers a stroke, the side effects is long-lasting, but many might not know that the 6 months after a stroke is the golden time for treatment and rehabilitation, where patients can recover from their stroke the fastest. He Zhenfeng is a retired military officer. A year ago, he had a cerebral hemorrhage, which hindered his language ability and movements.
The hemorrhage area is deeper in the brain, closer to the brainstem and central of the brain. The area is not considered large. It was less than 30 cc, so we didn't recommend surgery.
Taking into consideration the patient's needs, the medical team began Chinese medicine treatments after his vitals and the bleeding stopped to prevent further decrease of brain cells.
To prevent a second stroke, he needs to be healthy, and I put my trust in using acupuncture and Chinese medicine.
Cerebral hemorrhaging can be categorized into two categories. About 80% is the ischemic stroke, which is an obstruction within the blood vessel, blocking blood supply to the brain. The other is hemorrhagic stroke, which is the result of weakened blood vessels rupturing and causing bleeding into the surrounding brain.
Our experience with the Chinese medicine lets us know that the earlier we start patients on Chinese medicine, the better their nerve functions are after the stroke.
6 months after a stroke is the golden treatment period where patients can regain their strength the fastest.
We have been doing constraint-induced movement therapy on his legs and arms. Then about a month and a half to 2 months, we began movement contraction therapy.
Due to following the program set up by the Taichung Tzu Chi Hospital, Mr. He has regained about 60% of his mobility back.